information. That is invaluable. So I wanted to hand over the event to you today. Certainly, students, if you have any questions, you can put them in the chat. And certainly in between, we might put it out there to the world to ask questions as well. So thanks again for all that are joining today.
All right. Well, thank you guys so much for having me. I was super excited to get that message in my inbox and just happy to come back. I feel like I was just there in your shoes, listening to someone else and kind of grabbing what they were thinking about, seeing what I can do in healthcare. So I just put a quick presentation about myself and then my company that I work with and kind of how I got there as well. So here is little sections like what I said about me, education. As you know, I went to UNC Charlotte. I'm a late bloomer. I was an adult student. I took a little bit of time when I first moved to Charlotte, but we'll get into that. And then my past career experiences, how I got into healthcare, and then my company and any questions. All right, so I'm originally from Chicago. I was born and raised there. I lived there for 18 years, finished high school. A lot of my family moved to Charlotte, so we decided to just follow them down. And I've been here actually for quite some time, about a little over 10 years now. I've seen Charlotte change rapidly. I could honestly say that. What was I going to say? That skyline, when I first moved here, I swear it was probably like 4 buildings, and now it is huge and beautiful, and it is crazy the difference in just 5-10 years alone. But starting with my educational career, I went to Carolina's College of Health Sciences. So it was an associate's program. I did the surgical technology program, and what surg techs do is that you are part of the clinical team and the operating room team. So you are present for every single surgery. You are right next to the surgeon. You're scrubbed in. You're making sure that the surgeon has all their tools, everything they need for the patients. I did all my clinical rotations with Atrium Health. So I was at CMC Maine, Mercy University, all those locations. It was a 2-year program. Very hard since you did different rotations in different specialties. So I did a lot of plastics, general, brain surgery, heart surgery, anything. If you've seen Grey's Anatomy or House or any of those medical shows, just think of it that way without the drama, and just a lot of studying. So I did that for 2 years, took the summer off, graduated, and then I went to UNCC. So during that time, I decided, I have been in clinical healthcare for so long that I wanted to give care in a different way. And that's where it led me to go to UNCC, finish up my bachelor's, and enter the health systems management program, as you can see. And then I graduated with that and a minor in public health. And during that time, transitioning over to the business side helped me in a way because I didn't lose that touch with patient care. Even though I wasn't giving it hands-on, I was still helping in a different way. And then right now I'm currently attending Queen's University, which is in Charlotte as well. And I'm finishing up my MBA this May. I'm very excited because it is tiring. I'm a little tired. I actually haven't taken a break since my associate. So I've been going back to back to back. So I'm very excited, counting down less than a month, about to take my grad school picture soon. So it's getting real. And what is next after grad school? I'm not too sure. I spoke with my family, some of my friends, and like some of my mentors, should I get my doctorate? I'm not too sure. We have some people in my family that has their doctorate, but everyone told me just take a breather. And I'm pretty sure that is what I'm going to do. Take a year off, couple years off, because either way, if you decide to go or not, time will still pass. So just got to think about it, trying to find my hobbies again and stuff like that. But all right. Next with my experiences. So I was actually a COVID graduate for UNC Charlotte. So I graduated August of 2020. And then I have COVID fog because we had the graduation, we had the online one, and then we had the in-person one. So sorry if my timeline is way off, but yes, I did graduate during COVID. And I had my cap again. I remember in my living room, they had my name on online or on the TV or whatever we were doing. So that was pretty fun. But during my last semester, because I did take a summer semester, I did 2 internships during that time. And that's how I began my transition into the business side of healthcare. I balanced both United Way and Carteret Long-Term Recovery Alliance. That first internship as a COVID response research team member, since it was the peak of COVID, which was great with the information and the research we found, I was interviewing different corporate businesses and hospitals around Charlotte and the surrounding areas to see how they were implementing new COVID changes. How was their patient load? How are their employees, their nurses, their doctors, anything to help with that during the pandemic? We worked closely with our United Way mentors and people over there. And we developed this huge project at the end of that semester to present to the people of Charlotte that, that they were getting taken care of during that pandemic. So it was pretty interesting to speak to this C-suite executive people because from a student perspective, it could be nerve-wracking. That was my first internship. I'm talking to these really higher up supervisors and managers, but they were very nice, very informative. It was great. And then my second internship with Carteret, I was a disaster recovery case manager. I think it's Carteret. Sorry, that's my pronunciation. I was a disaster recovery case manager, and that position or that internship managed families who, let me see if I could put that correctly, families who got their homes devastated from the past hurricanes in eastern North Carolina. I never made it out over there, but I know it was pretty far out. But yeah, no, it was very fun. So I handled a lot of case management, meaning I had a lot of families that I was working with. They're either missing a roof over their home, their garage is all messed up, they don't have a balcony anymore, a patio or whatever because of the hurricane. And believe it or not, even though that hurricane, I forgot which one I focused on, even though it was years ago, their homes were still destroyed and messed up to this day. And that was 2020. So you could just imagine, I'm hoping 3 years later, I still see those updates. I still follow their pages and seeing what they're doing on YouTube and stuff like that. And they're doing great. They're still going out there building new homes and doing that for their people. So that was fun. Those 2 internships were awesome. I mean, all summer. So just a few months. And then I graduated, like what I said, August 2020. So my first corporate experience, I became a nurse immigration case manager at Worldwide. It's a very long company name, so I'll just name it Worldwide. So that position, you helped with foreign international nurses moving overseas to the United States, getting their green card, getting their social security card, and then living here as a permanent citizen. That position was very rewarding because you were working with these nurses for a very long time because you had your set nurses. I think I managed 250 nurses at one point. And then I had several facilities in the United States, Arizona, Philadelphia, Minnesota. It doesn't matter. Like we had hospital contracts all over the country. And it was rewarding because they're moving from countries like the Philippines, Dubai, Africa, Kuwait, and they were giving their all to move here. And I got the opportunity to actually meet them at the airport in Fayetteville because I staff for Cape Fear Hospital, and they moved their whole lives in two bags, 2 luggages, and then their whole family. And it was very rewarding to see that they're going to give care in their home country and come over here to a brand new world and still continue that healthcare that they're giving. So I did that for about a year. The company is small when I first started with them back in 2020. And that kind of gave me the heads up of, okay, let's go ahead and continue to grow. And that's what my manager said. She said, there's nothing here we can place you in. You know, it's very small. You're going to do the same thing. You know, we're okay if you want to keep looking. You know, we will give you that recommendation, that referral, everything like that. So I found myself transitioning to becoming an associate recruiter for travel nursing for Pride Health. Now, Pride Health was or is located in New York, but I worked remote here in Charlotte. It is a whole different breed because I think travel nursing kind of dipped into your sales experience. Staffing was so different than corporate recruiting. And I think I almost got burnt out by that position. I was there for about a year, but it taught me it taught me a lot. It was difficult as far as metrics. It was a very, very corporate, um, and I learned a lot. Yeah, so we're gonna I think I'll say that for Pride Health. It was fun though, since I still handled numerous hospitals throughout the country, but now I was there for another year. So currently, as a talent acquisition consultant for HCA Healthcare, I actually started as contract back in October 2022. And at that time, I think it was a 4-month contract. And like, once again, I was giving my all. I was jumping into it, learning, handling all my work, taking all these notes. And then they converted all the contract people to permanent December 2022. So now I'm permanent moving forward, which is great because then you have your benefits and everything like that. So that's where we're at. Let me X out of here and see if I could share. Can you guys see the HCA slide or no? Oh, perfect. All right. Okay, how did I how did I do that? Did I just put present? Oh, where'd it go? Well, we'll just keep it there. Okay, so HCA, this is our mission. And I wrote this for grad school because we had to talk about our current organization. But above all else, we are committed to the care and improvement of human life. HCA started in 1961. I will not go through this whole thing because it is very long. Just know they've been here since 1961. Actually, the owners of HCA also helped open KFC. I had no idea until I went to the orientation for a new employee. So I thought that was pretty neat. But HCA stands for Hospital Corporation of America, founded in Nashville, and they're one of the leading hospital providers in the whole entire country. As you can see here, we also have locations in the UK, which is great. And we are also a Fortune 500 company. And here is the map of all our locations. This is also what our regional teams are called. So right here, I'm in North Carolina. It is so small, but you can see it's only Western North Carolina. So for example, for talent acquisition, I handle Mission Hospital in Asheville and the surrounding facilities. So Blue Ridge, Marion, Lake Lore, all Western, all the mountainous regions in North Carolina, that is what I handle. I think before I hopped on to this presentation, I think I counted right off the bat, I have 30 hiring managers in about 30 facilities that I help staff for. And then I handle about 70 requisitions, meaning if you go to a company career page, you will find, those job openings. Okay, here's a full-time RN. The person who posted that would be me. And it goes through our system. I get the candidate flow, I get your resumes, and then I walk you through that candidate process. So that's a little bit about my day with HCA, but I think I found out, or totally forgot here. Sorry. How did I get here? Networking, LinkedIn, and joining organizations. I can honestly say using LinkedIn for my 3 past corporate positions, that's how I got my jobs. I vamped up my LinkedIn. I added to my network connections, and I followed my organizations and pages. Even though I'm not working for hospitals in certain states like Illinois, California, Arizona. I'm still following them. Surround your timeline with what you want to be a part of. I noticed my whole timeline for LinkedIn is all healthcare and finance because of my MBA, but it's a mixture of both and data analytics within healthcare. At the end of it, my foundation and my root of my LinkedIn timeline is healthcare. And then I networked. We had mentorship programs at work and at Queens, which is great because they turn out to be your friends at the end of it. And I kept it. We were very professional, because when you're part of the mentorship program for Queens, it's also an alumni that walks you through how they got there, their career, and everything like that. And also online events. I haven't really dipped into Handshake, but I know here for our career, for our company, we use Handshake a lot, which I'm trying to get that vamped up for my units, since some of my nursing units are pretty hard to recruit for. And then school in-person events. When I was at UNC Charlotte, um, if I just found out there was an event in like 10 minutes and I didn't have anything to do, my friends would just stop by and go talk to whoever was running it, see what it is about. Even if, you only have 5 minutes, go ahead and stop by. Make your presence known, introduce yourself. I remember I had atrium leaders come to UNC Charlotte, and they were very informative. They were in our classes and they were talking about atrium. And at the end of it, you just go up to them, introduce yourself. I ended up getting her email, talking about shadowing with her. And from there, I was, shadowing her at atrium and seeing how her day was like. And that was really nice of her. She didn't have to do that, but, it was good to meet her and her team and everything like that. And also joining your organizations. A lot of my companies, they dove deep into their DEI groups. So we had ERGs, which are employee resource groups, and colleague networks. So for example, I'm part of the Asian and Pacific Islander colleague network and also the Female Women's colleague network. And there's just a lot of ERGs out there that you could join. There's veterans or moms or stuff like that, and they also have random book clubs in your companies, if they have that. So they're always popping up. It's very fun. But I think the one thing my mentor told me and that I keep telling other people is just network. You never know who you're talking to, even if you're at the gym or going grocery shopping. For example, when I'm walking my dog, I think I met someone who's the owner of one business, and I told her, I said, I had no idea that I would meet you just walking my dog. And from there, now we just see each other and catch up. So that's what I learned here, living in Charlotte and kind of creating my career here. And yeah, I don't think I have anything else for HCA. I cut this one short because they actually gave me like 50 slides and that wasn't going to cut it for us. I was like, they're not going to do that. but yeah. And then this is my contact information. You can find me on LinkedIn. I think I'm the only one with Robyn Cabanero. So I know some people have the same name, but that's me. I guess I'll stop sharing.
So students, if you have any questions for Robyn, feel free to throw in the chat or just unmute yourselves.
Hello.
Hi, Travis.
Hi, I have a question. I've been hesitant to start a LinkedIn, and I'm going to be graduating in December with the health systems management degree. Do you have any tips for getting started with it?
Yeah. If you have any friends or even family that has LinkedIn, that's how I started. And then your mutual connections and your networks kind of pop up when you make your LinkedIn. I noticed when I first started, I added people from UNC Charlotte, even if I didn't personally know them, only because you're building that network. So since you go to UNCC, I would suggest just adding students from there first and then building up. From there, you can also connect with me. so we can kind of vamp up your LinkedIn as well. I'm really good at that. I help a lot of people with resume building since I have to review a lot of my candidates' resumes, and some of them not very pretty, and they're, you know, they've been in corporate for so long. So you can just imagine, like, there's no like 100% perfect resume. And I think that's what I keep telling everyone. As long as I see the information I'm looking for, do that. And don't be silly with putting your undergrad positions as well. I worked all of my undergrad college positions. I mean, it was silly. I went from Chick-fil-A, Walgreens, J. Crew, but I had that all on my LinkedIn, because once you put that on there, your algorithm for LinkedIn, your network just pops up. You can find so many people that work for the same organization. And yeah, don't be afraid with adding people. It's not like that anymore. I see the change from 2020 till now. I have a lot of LinkedIn followers and stuff like that, and it's okay if I don't know them, but I see what they're posting, and if that's what you like, you could go ahead and accept it.
And Travis, just to further Robyn's comments, here at the Career Center on campus, we do a lot of work with helping you build your LinkedIn profile to get started. And then, of course, to Robyn's point, growing that network. So we have drop-ins Monday through Friday, 10 to 3, and also you can make an appointment with your dedicated career coach.
And can you still use the Career Center when you graduate?
You sure can. It's for alumni as well.
Okay, thank you.
You're welcome. And I think Cheyenne had a question, and then Olivia in the chat, Robyn, just so you know.
Oh, okay. How did you like clinical work versus the more administrative side of healthcare? Oh, I love this question. Okay. How can I put it? My first position when I moved here to North Carolina, and my first job overall, I was 18. I became a CNA. Yeah, it was very, it was stressful. I was 18. That was my first position. I decided to work at an assisted living home. I worked second and third shift. I was doing 17-hour shifts and going to school the next morning, and I almost burnt out quick. And then from there, I was like, hey, let me reel back on the clinical. Let me study clinical instead of working it real quick. That's how I got into my associates. Clinically, it's tiring because it's mental and physical, because I was getting up at 5, going to Atrium, and I was there all day for surgeries. But when I came home, you were like, wow, I helped out with this amazing surgery. I saved someone's life, essentially. I'm not too sure what I did, but I made an impact on my OR team. But that's kind of what I had. It was more physical for me. Getting up, going there, you're there for 8 hours. There's no rest when you're doing a surgery. There's no such thing as a 15-minute break. Can't swap out. You know, you are their person. And then the administrative side, I noticed for me, I transitioned into more mental fatigue only because I am doing grad school and working full time, but I work from home. So I got so used to it that I had to re-socialize myself again since COVID, like everything was work from home. But the administrative side is really more corporate. And that's where you start to learn how to write just a simple email, and just to talk to your managers, do intake calls with supervisors. And that's how I learned kind of my communicative style with corporate. I think corporate life and then the clinical life is completely different.
Yeah.
Mm-hmm. Okay, Olivia, what advice you may have for with no experience working within the health field? What kind of position should I be looking for? I'm more geared toward administrative and management work. That's a good question, because for Asheville, I staff practice specialists, and talking to my managers, these practice specialist positions, they're not looking for anyone that's been in the industry for 5 years. When I talk to these supervisors about entry-level positions, they just want you guys to be moldable and trainable, because since if you don't have any experience in healthcare administration, they're even more excited to bring you in, because they have this idea, this plan in their head for how they would want their employee to be, how they want the clinic to be. And you can learn a lot about that company, whatever you're going into. So, but yeah, I hope it answered your question. Oh, what kind of positions? Oh, I'm sorry. I would do, that's a good question, but I think reception positions for, like for Novant, for example, they have patient services coordinator positions, and then Atrium, they have some of the same things. So anything with coordinator positions, receptionist or practice specialists or clinical specialists, those are geared towards entry level positions. That's what I see with HCA as well. That's how we title those positions. And then, oh, ooh, nursing school. That's hard. Kudos to you. And does most of this job still offer training? Yes, every single one. And that's where I got scared transitioning into the business side, because I didn't know how training was. When you're doing clinical, you're doing retail or anything hands-on, you know, you're with someone all day, training for 2 weeks. And that is the same exact thing I got transitioning into the corporate side of healthcare. Each position I had was about a 2 to 3 week training. I would say my last position with Pride Health, that was extensive. That was 3 weeks of uh, company training, 2 weeks of team training. And then this position, I had 2 weeks. And then you still have that 90-day period of transitioning into this position. So your managers ask you if you're okay, you need any help. You have your trainer that constantly checks up on you, make sure everything's okay. Because I know when I started this position, when I was on my own that first week, I think I had a bunch of work I inherited and it looked like I was overwhelmed, but I had people checking in on me and I was able to catch up. So training is still, yes, that is side by side. I had 8-hour training every day. All right, what type of career do you plan on pursuing with your master's? That's a good question. I actually tried to change my career. I think last year I was getting burnt out with travel nursing. I started looking into finance, but this recruiter from HCA fell into my LinkedIn message, and that's how he found me. So I said, you know what? I've been in healthcare for so long. This is my passion, that I finally realized that I want to help people. So I stayed in healthcare. I think with my master's, I'm still going to be in healthcare, possibly more leadership, strategic innovation, and even healthcare consulting. Anything with what HCA can offer or another company, I will definitely still be in healthcare. And are there growths in base pay? Yes, I think, are you asking if for like salary wise? Yes, there is. I could say there was a jump from when I first started to now. And you just have to trust your gut. You know, if you decide to find something new, and you decide that that's the company for you, the recruiter was great, the interview with the manager is good, and you like where you want to settle in, go ahead and trust your gut. But with base pay, yes, there is growth. Each company I've had since I've been there a little over a year, we've had increase, your yearly increase. And then, do you recommend virtual work over office virtual work? If so, what are your pros and cons? Ooh, that's a good question too. Okay, so my first position, because it was COVID, it was all work from home, and then they switched it where we had to be hybrid. Now, I liked it because I got to see my colleagues who also became my friends during that time. But also at the same time, I think the way they set up the desk, you kind of were like, "Ooh, I wish I was at home," because you were very close together. So it's pros and cons because one, traffic, gas, you have to get ready, dress up. As a girl, you have to wake up earlier to put a nice outfit on and do your hair and everything like that. And then when you're working from home, I can make my own food. I can walk my dog. If I need to check school real quick, I could pull up my my MacBook and I have work and school side by side. So there are pros and cons, but I think at the end of the day, for me, and what I tell people is time management. It's like, what do you have to do today? I set myself up for every day at the end of, like, for example, today's Tuesday, I would set myself up for Wednesday. It's going to look silly, but I have little highlights, and that's how I get ready for my next day. If I'm winding down at 3 or 4, I decide, what do I have to do tomorrow? Write it down so you don't forget. And then the next morning when you wake up, even though you're tired, you're like, okay, this is what I have to do. It's in your face and you can get going. Let's see. Landing a remote job has been so hard. What are your tips for someone looking for one? You know what? I agree, because when I was trying to transition into finance, I was still doing and applying for remote work, and it was very hard. I think a lot of these businesses just want people to come in again. For example, someone I know has to go in Monday through Friday, and they told him that it would be hybrid. There has not been a hybrid schedule for in the future for him. And now he's wondering, like, why did the recruiter tell me that? But what was I going to say? Just don't stop. I think this last round that I was looking for with HCA, it took me about 3 months to find a new position. Before, it took 2 weeks, but that meant it was a red flag, since it was, very hard position, and it was just, mentally exhausting. So this time around, before I found HCA, it took me 3-4 months to find this remote job. And also, if you want, go ahead and apply to other cities. I think at that time I was also applying to Chicago, New York, Philadelphia, any cities that were open to having you remote, and also just building that network as well. All right, I recently switched my major. I want to know what type of jobs you're looking for with that degree. Huh. What was I looking for? Sorry, I'm thinking. That's a good question, because I can honestly say I blindly applied to my first corporate position, which was my case manager position. They didn't tell me the company name. They didn't tell me where it was. It was one of those, like, hidden positions, and then I got a call, and then I did the interview. So what I was looking for was things that you're going to be good at. Are you good at writing? Do you like research? Are you more qualitative or quantitative data? I could say I'm in the MBA program, but Excel and financial reports and stuff like that, I'm not as strong. I'm teachable, but I'd rather do reports that are more qualitative. I could write papers. I can write these emails for my managers, do intake calls, really cultivate my customer service experience with my manager. So that's kind of what I was looking for. If you're reading something on an application and it kind of scares you, go ahead, copy and paste and go to Google. It's exactly what I did, because if I didn't know what that meant and I'm like, okay, I can learn it. Or if you're like, you know what, I don't think I can do that. Like what I said, gut feeling, because if you do get that position and all of a sudden you're thrown into it and you're like, this is not what I was looking for, I wouldn't want you to go in there either. This position I have right now, my team is great. It's very professional, it's very corporate. I don't think I've had a team like this yet. Well, also I've only been doing it for 3 years, so, but I lucked out. This is great. There's no office here in Charlotte, so I do drive to Asheville when they need me to. I was just there about 2 weeks ago, just do a day trip and come back, and I think I have other events coming up too around Charlotte and Asheville and Greensboro, so we do travel. Mm-hmm. All right, well, anything else?
I think we've had some amazing questions today.
Yes, thank you. And I think one thing that I learned with the transition from being a COVID graduate is just protect your mental health and um, don't compare yourself. You know, if you're like, oh, I'm turning 22, 24, 24, whatever you are, it's okay. Don't compare yourself to your friends. Take a deep breath because you're gonna find what you're looking for, and then you'll finally be like, wow, I'm here. But 3 years ago, I was still doing undergrad, and that's when I look at it. I'm like my life since UNCC like totally flipped, and I had no idea that I would be here. But I am so grateful because, like what I said, protect your mental health. If please take PTO as well. If you get PTO, do not hold on to it. If you feel like you need a Friday off, do it. I used to do that. I used to work on vacation. Why was I doing that? I don't know. But I felt like I didn't have enough. But then someone said, what are you doing? You could go to the beach. I was like, you know what? You are right. I'm going to take a day off. So remember that too.
Absolutely. It's just as important. The culture,
Yes.
you take care of yourself and the content of the work that you're doing. Absolutely.
Mm-hmm.
Well, Robyn, we so appreciate you being here today. And this has been amazing from an information standpoint, and just, you know, the fact that you're an alum, we kind of like that too.
Of course. No, thank you so much. Yeah, I was going through my closet and I had all this 49er gear and I was like, I'm not getting rid of that.
I know. Exactly.
Because even though I go to Queens, I still say like, no, I got my undergrad from UNCC.
Exactly. And congrats on your MBA. That's awesome.
Thank you.
And for the rest of you students, thank you for joining today. We're going to be hosting some other events for the rest of the week relevant to your population. So please check us out at career.charlotte.edu. And we have events posted on the banner on that page. And thank you all again. Hope you have a great day. Thanks, Robyn.
Thanks, guys.
Thanks, everyone. Thanks, Robyn.
Bye.
Bye.